I sit on the board of the National AIDS Housing Coalition. We've had 5 AIDS and housing research summits, so we've really worked to elevate housing to be on the same par as prevention, healthcare, support services, that, you know, one without the other is the precarious house of cards that collapses in on itself.
Sure. I can't imagine, you know, I mean, obviously I can't imagine what it's like to be, you know, infected to begin with, but I mean, it's got to be a terrible thing. But to be, you know, in that position, and then to be homeless on top of that.
Right.
That's
Devastating.
It's a horrible thing. How, you know, I'm not sure how you deal with that. It's just
the stigma is very high. I mean, there's still some people who, when they get tested, don't enter into care because it's so difficult to say I'm HIV positive,
right.
even to a healthcare provider or a social worker.
Right.
And then you add the more and more layers to that. You know, family, friends, coworkers. You know, it's really difficult. I mean, the disease still carries a tremendous amount of stigma nearly 30 years later.
Yeah, yeah. It's funny. I remember very well that period. I had sort of just become sexually active at the time that the AIDS thing happened, and it scared me to death. It's like, okay, I'm going to go hide in a closet somewhere.
Kind of puts a cap on
Nobody's
things.
ever touching me again, you know.
But I think in the early years of the epidemic, we were scared, and rightfully so. And with the advent of medication and the Ryan White Care Act and support services and housing, and, you know, in a state like Connecticut, in general, people have very good access to health care if they're HIV positive. At the same time, though, we've taken the fear out of AIDS. I mean, I don't know if you guys have ever seen Pause magazine. It's, you know, about HIV positive folks. But a lot of times there's like these really buff, good-looking people climbing mountains or biking or whatever. And great. I mean, for a lot of people, yeah, that can happen. And there's some incredibly sick and fragile people. You know, when I talk to legislators, I often say, you know, we don't just have a medically fragile population because HIV is episodic. People can be really healthy for a long period of time, and it can tank in a snap. Through an opportunistic infection, or their virus mutates and their medications no longer work for them. They'll have to get on a new, you know, regimen. But we also, in this state and in many other communities, have a very socially fragile population. It tends to be very poor. It's primarily people of color. Again, you know, 50% of the HIV cases in Connecticut are directly attributable to injecting drug use. Many folks have mental health issues. So we have a very socially fragile group of folks, too, that need a tremendous amount of support. You know, and with regard to youth, you know, I mean, we were all young once. We remember, you know, nothing was going to touch you.
That's right.
I mean, I went for years without health insurance. I think back, you know, when I was in college, I had very minimalistic health insurance through school or something, because, you know, nothing was going to touch us.
That's right. You're indestructible.
Indestructible. And I'll tell you, I talk to folks and work with folks who work with youth who are infected and affected by HIV, and they're telling all kinds of stories. Again, particularly young men of color who have sex with other men who are newly infected, and they don't have the information. I mean, you know, I remember, again, in the early days of the AIDS epidemic, you know, we were going to the gay bars and stuff and handing out condoms and talking. And when we talked about sex, we talked about hot, horny, healthy, safer sex. We just came through 8 years of the Bush regime when it was abstinence only.
Right.
Right? So, you know, we've had a difficult time, and I forget how many millions or billions of dollars went to abstinence-only programs, but there was a lot of money put out there. So, you know, when we've been talking about this in our HIV planning consortium about we need to go back to our roots and bring sex back out in the open in a healthy way. You know, we're all part, you know, a lot of us are part of a Healthy Teens Coalition that's looking at, we were hoping to get funding, incentive funding to schools that would provide comprehensive sexuality education that was evidence-based, age-appropriate. I mean, Cuba provides comprehensive sex ed from kindergarten on up. We don't. Connecticut does not. Each of the little, 169 little fiefdoms around the state decide what they want to do, if anything at all. New London actually does a terrific job. They're one of the communities that we know that's sort of out in the open, that the school system has a great rapport, relationship with the mayor around comprehensive sex ed. That's not true in most of the other cities and towns in the state, and that's a real issue. We have youth that aren't educated about HIV and AIDS or other sexually transmitted diseases. They're not educated on how to negotiate relationships or how to recognize if they're in an abusive relationship.
Right.
They're not educated about how to, the proper use of a condom or how to protect themselves sexually. And I come at this both as an AIDS activist and as a parent. I have an almost 13-year-old son, and I want him to have this information. I think it's important.
Yes.
And if he's not getting it from school, he is getting it from me.
Well, good for you. It is, though. But that's one of those things that sort of concerns me because we obviously, we sort of lived through the beginning of the AIDS thing. Mm-hmm. But there is a whole generation now that have sort of grown up in a society where it really hasn't been talked about that much.
No.
Well, and when it has, it's just another big disease like diabetes and cancer where they've got stuff that makes it better. Or
it's the gays and the addicts. So It's not me.
Right.
And that's just not true.
It's not true. And I want to qualify that a little bit. I mean, anybody who engages in high-risk behaviors, whether it's needle sharing or unprotected sex, obviously is at risk of HIV. But even with unprotected sex, I mean, there is kind of a hierarchy of higher-risk behaviors, lower-risk behaviors. But if, kids aren't being educated, and all of us who've worked in the world of HIV and AIDS know young women who are infected by their first-time boyfriend or a long-time partner or their husband. And whether or not that person knew they were infected or not isn't the issue, but people assume, he looks healthy, he's been my only partner, he's the only person I've had sex with, we've been married for 10 years. Mm-hmm. There's a move that the Centers for Disease Control in 2006 came out with new guidelines around routinizing HIV testing in medical settings. So when we all go for our annual physical, your doctor is going to do blood work.
Standard blood panel.
Sure.
Just add it to it. And there would be we actually changed the statute in Connecticut to make it easier for that to happen in routine medical settings. And we can do an HIV test with that. You could opt out and say no, but a doctor or nurse practitioner would no longer have to do the whole counseling and test, the whole pre-test counseling, do the test, post-test counseling, and have separate written informed consent. It would be more routine. It's not happening, and we have sub-work groups on all these different issues. We have one to do identify the people who are unaware and get them tested and treated. We have another work group that's looking at, how do we promote this? How do we change the culture in the medical community to make this more of a reality? Because we're not finding those folks through the state-funded counseling and testing sites who do terrific work, but they have a very low positivity percentage of people they identify. So to make it more routine, on one level, the CDC wants to do this to identify those people who are unaware, but also their thought is to reduce stigma. I'm not so sure that it will actually reduce stigma. I think that's a much bigger cultural and social issue and personal issue that we have.
It might reduce some of the stigma around being tested.
Correct.
But not necessarily around being positive.
Good point. I think that's exactly it. And I think that's where I, kind of bump up against it.
Yeah.
The bigger problem is the stigma about, surrounding living with HIV/AIDS, having it.
Yep.
But if we can take a little bit of the stigma off the front end.
Sure.
Yep.
That makes perfect sense. If everybody gets tested, then I can say
it's no big deal for you to have gotten tested.
Right.
It's not indicative of something that you might be embarrassed about.
And it's funny. I did not that long ago have an AIDS test because I was having some surgery out of the country, in Canada, and the Canadian surgeon required it. But that's the only time that I've ever seen that any kind of surgery in this country it was never indicated that, you know, you have to have this before we'll do surgery. They did that sort of routinely in Canada. And I was sort of amazed at how involved the whole process was with the counseling, you know, and my doctor, who was a sweetheart, was very good about the whole thing, but all the counseling and then going for the test, you know, the blood work and everything. And I did have sort of a feeling like, you know, that people would be looking at me, you know, at the place where I was being tested. It's like, you know, why are you having an AIDS test? And I sort of felt that. It didn't bother me, but I was sort of aware of it, and but it was sort of a big deal to get to the point of actually doing that.
And I mean, also you figure, okay, you've got the form, you walk into the office, the phlebotomist fills out all the paperwork and takes you in back, and okay, we're going to draw blood for an HIV test. You're here for that one thing. It's a special separate thing.
Yeah.
It was separate, yes. I had also had other things done, but the actual the AIDS test was a separate thing.
To get tested for HIV,
yes. It was a whole separate thing.
Can be a whole separate thing.
It was a separate piece of paper and everything. It wasn't a routine.
So that was before we changed the law.
Where you get the great big form and there's like 6 check marks and something that looks like a signature.
Yes.
Right.
What's your doctor's name?
But the other thing is, you know, in having these conversations with other advocates around the state, you know, we've all sort of said, you know, what our annual physicals are like. You know, are our doctors even talking to us about our sexual health and our reproductive health? You know, and I have friends who are openly gay men, in relationships or not, and I would say almost without any exception, their doctors have not asked them, are you sexually active? Are you have multiple partners? Do you use a condom every time?
Yeah.
You know, have you had an HIV test? And my doctor happens to be an infectious disease specialist and an HIV specialist. So those conversations have been different with Ken, but that's, you know, that's not most people's experience.
Yeah, that's interesting. I certainly, my doctor, who is a sweetheart, does always covers that ground.
That's
and
really
your doctor
unusual.
also now.
But I go to your doctor. So.
But yeah, he always goes there.
What's
he's very thorough.
What I find kind of interesting is, I mean, you'll hate me for this, I know, but I was in high school in the early 90s, 89 to 93. And,
okay, we do hate you.
I'm used to it. She reminds me.
Sounds side with you, Al.
And you know, I do remember sex education. I do remember them teaching about options. I do remember them teaching about HIV/AIDS, and that makes sense because that was sort of the scare time. That was a big height. And I do remember, you know, going to the doctor. By the time you hit puberty, the physician, your annual checkup, they were asking you if you were sexually active. They were asking you, you know, about drug use and everything. And I've noticed, after you mentioned it, I start thinking back, and it's like, you know, the last 10 years, 15 years, I'm not sure that I've, you know, it's petered off.
Yep.
It has. It really has.
I think there's a combination of things at play there. I think, one, the advent of managed care really, I think, destroyed doctors' ability to develop relationships, for the most part. I mean, there's obviously exceptions. To have relationships with their patients, because you were in and out of there.
They learned to talk faster.
Yeah, it was like, you know, it was all about billing and diagnostic codes. And, you know, I remember doctor's appointments when I